You feel the cabin hum, the recycled air cool on your face, and an announcement drops into the background, then the soft shuffle of concerned passengers. Someone 2 rows ahead has gone pale. A flight attendant kneels in the aisle, voice low but urgent. That sound, the metallic click as a medical kit latch opens, is the moment most people who fly rarely imagine and dread. Imagine you are on that plane. Your hands are on the armrests, you can smell coffee, and the captain's calm voice tells the cabin to remain seated while crew check a passenger.
If your flight happens to be canceled or delayed, Compensair will help you get compensation for the inconvenience and get your money back without wasting time on red tape. Get a refund for your canceled flight right.
That is the opening most airlines train for. Keep the cabin calm, isolate the problem, use the tools and training available, and decide whether the plane must land now or can continue. I'll walk you through what the crew will do, what you can do before and during a flight, why those rules matter, the real costs involved, the safest choices, and one misleading fee or trick to watch out for. Before you travel, prepare and reduce the chance you'll be the emergency. Carry a 1-page medical summary in a clear sleeve in your carry-on, diagnosis, current medications and dosages, allergies, emergency contact, and last tetanus/flu shot dates if relevant. If you have a chronic condition that could flare up, heart disease, severe asthma, blood clot history, epilepsy, recent surgery, call the airline at least 48-72 hours before departure and ask whether you need a fit-to-fly clearance form or special seating. Pack essential medications in your carry-on, clearly labeled and accessible, and keep a small letter from your prescribing physician if you use injectable meds or oxygen concentrators. Print boarding documents and keep digital copies of prescriptions and a brief care plan on your phone. At the airport, explain any recent changes to a gate agent if you're unsure about fitness to fly. If you need a wheelchair, request it at check-in and confirm with the gate agent. That request is not an upsell, it is assistance. If you're a rare flyer with anxiety about being the person who needs help, tell a crew member discreetly before boarding so they can seat you near the aisle and keep an eye on you. On board. Here's what actually happens when someone goes unwell at 35,000 feet. First, flight attendants perform a quick assessment, check responsiveness, breathing, pulse, and look for obvious bleeding or airway obstruction. They will locate the emergency medical kit, EMK, and the automatic external defibrillator, AED, stored in designated compartments. If oxygen is needed, portable oxygen or the built-in oxygen system is used. Attendants know how to fit a mask quickly. An announcement is made asking if there is a medically qualified volunteer on board. Private pilots, doctors, nurses, and EMTs often step forward. The crew will relay medical details to the cockpit, and the captain will consult airline protocols and ground-based med advisory services. That call, between the flight crew and the airline's medical support, is where the decision to divert or continue is made. Why that decision is conservative. At altitude, you are in a different environment. Cabin pressure is equivalent to a high-altitude environment, roughly 6,000, 8,000 feet. Oxygen levels are lower, and the aircraft is a confined space with limited medical supplies. Think of it like driving a car that develops engine trouble on a long bridge. You can limp to the nearest exit, or keep going at reduced speed to the next town. But the longer you delay, the bigger the risk you'll be stranded with no help. Similarly, pilots weigh the severity of the condition, proximity to diversion airports with adequate medical facilities, weather, fuel, and the safety of all passengers. That everyday analogy explains the caution. The nearest airport is the nearest place to get help quickly, and delaying the decision increases the risk to life. What the crew has. Most major airlines carry an emergency medical kit defined by regulator rules. Contents vary by region. Expect basic airway tools, intravenous tubing, epinephrine, aspirin, nitroglycerin, antihistamines, albuterol inhalers in some kits, and an AED. Some airlines also carry emergency medical oxygen cylinders and stretchers or splints for basic stabilization. Crew are trained in CPR, bleeding control, and initial triage, but they are not paramedics. Ground-based telemedicine doctors can hear the description and advise whether landing is necessary. How likely is a diversion, and what does it cost? Diversions are rare, but happen. On a typical long-haul flight, there might be one serious medical diversion in a few thousand flights. If a diversion happens, the airline bears most of the immediate operational cost. The flight may burn extra fuel, reroute, and require ground handling at an unscheduled airport. Those airline costs can range from a few $1,000s, short diversion, to tens of thousands if rerouting and passenger reaccommodation are complex. For the sick passenger, hospital bills after a diversion are the responsibility of the patient and/or their insurance. Costs vary wildly. An emergency room visit in a regional airport city could be $500, $5,000. An air ambulance or international medevac from a remote field can run $20,000, $200,000. Travel insurance with medical evacuation coverage can cut that risk dramatically. Check limits and pre-existing condition clauses. Risk to your trip. If the plane diverts, all passengers may miss connections. That means hotel and rebooking costs for you. Airlines generally rebook passengers on their next available flights at no extra fare if the diversion is the airline's operational decision. But if you have a tight international connection, expect delays of several hours to a day, depending on aircraft availability and crew duty limits. Worst case for the ill passenger is delayed definitive care. Worst case for everyone else is long delays and missed connections. The cheapest, safest, practical approach for the passenger? Manage health risks before departure, carry medicines, bring a concise medical summary, and buy travel insurance that covers emergency medical care and medevac with a solid limits page. If you have a condition that regularly causes breathlessness at altitude, ask your doctor about supplemental oxygen options and get a fit-to-fly certificate. If you feel unwell before boarding, cancel or change the flight. Many insurance policies and airline policies will be kinder if you call ahead and can document a doctor's recommendation. A mid-script, quick request. If this is helping you feel safer about flying, please hit subscribe, and I'll make more short, practical guides. Many useful links can be found in the description. One hidden trick to watch. Some third-party booking sites and agents will mark a ticket as confirmed, but fail to flag the airline's internal notes where a passenger needs medical clearance. That means you can show up and be denied boarding or be told you need a physician's fit-to-fly form at the gate, often with a last-minute insistence on a medical handling fee or a cargo handling charge if special equipment is needed. That fee is not a government tax. It is an operational charge that can range from $50, $500, depending on the airline and local handlers. How to refuse and prevent it. Call the airline's medical desk before you buy or within 48-72 hours of travel. Obtain written confirmation of any required clearance form, and if a fee is quoted at the airport, ask them to provide the policy citation in writing. If the airline still refuses, document names and times, take photos of the paperwork, and escalate to the airline's customer relations after your trip while seeking a refund from the agent or your credit card if the charge was applied unfairly. A real-world example. An older passenger with a history of heart disease felt lightheaded mid-flight. Flight attendants administered oxygen, gave aspirin, and used the AED pad to check rhythm. The machine showed no shockable rhythm. The captain consulted medical control and diverted to the nearest airport with a cardiology-capable hospital. The diversion cost the airline about $12,000 in fuel and handling. The passenger was treated and released the same day with bills covered by their travel insurance after a $1,200 emergency room visit. That is not an outlandish number. It's the scale of what can happen. What you should say if someone goes down near you. Stay calm, remove your tray table if needed, follow crew instructions, and if you are medically trained and step forward, clearly state your credentials and what you will do. If you are not a medical professional, keep the aisle clear and avoid offering unqualified advice. Crowding makes treatment harder. Flight attendants may ask you to assist in taking a pulse or clearing space. Follow instructions. Legal protections. Many countries have Good Samaritan protections that shield volunteer medical professionals from liability when helping on aircraft. Airlines also have internal policies for handling passengers with medical needs. However, liability and coverage for medical transport and hospital care are separate. Travel or health insurance is your protection for the financial side. Final practical checklist before you fly. 1. One-page medical summary in carry-on. 2. Enough medication in hand luggage plus copies of prescriptions. 3. Travel insurance with Medivac and pre-existing condition waiver if needed. 4. Phone number for the airline's medical desk saved. 5. Seat choice near an aisle if you have mobility or breathing concerns. If you're on a flight and notice someone becoming seriously unresponsive, tell a crew member immediately and be as specific as possible. Describe color, breathing, and any known conditions. The faster the crew knows, the faster they can escalate to a diversion decision. One last caution about upsells. Airlines sometimes market medical assistance services through third-party providers at booking, a concierge who promises faster handling for a fee. Often that fee just buys a phone call and faster paperwork. It does not change the medical assessment or the captain's safety decision. Don't pay extra, believing it will guarantee you a non-stop flight if you are unstable. Instead, get documentation from your physician and speak with the airline medical desk directly. If you found this clear and useful, please like the video and subscribe for more realistic travel advice. Your calm, practical choices make flying safer for everyone.